Hi, everybody. I just want to thank you guys for listening to my presentation for the team leaders. I just wanted to discuss a couple different things with you today. We're going to talk a little bit about COVID and what Sunset's doing to go ahead and protect our individuals and staff from COVID. We're also going to go ahead and look at basically the numbers that the Office of Developmental Programs uses to basically give us recommendations on what we can do at Sunset to protect our individuals. I also want to talk a little bit more about our Therap and what we are doing as far as going into phase 2 of Therap and what your responsibilities as team leaders whenever it comes to Therap. So the first thing I want you guys to see is let's go ahead and we'll start with Therap, and we're going to talk a little bit more about COVID, but in particular concerning where to find things concerning COVID in Therap. So go ahead and log into Therap. Once you are logged in, there should be an option here for agency. If you click on agency, there is a place in there for document storage, or agency-wide document storage. If you go ahead and click on the search options and just go ahead and hit the search button, basically it's going to give you what our policies and procedures and also our COVID-19 policies and procedures. So if you click on that and you click on the PDF document, you'll go ahead and you'll be able to download the PDF version of our COVID guidelines. So feel free to utilize this, look into it, and it basically gives us step-by-step instructions on what we need to do in order to protect our individuals from COVID. Lots of detailed, good information that is in here. Feel free to look that up. But under visitors in the homes, I wanted to talk a little bit more about PCRs and basically our low, our moderate, and our substantial categories whenever it comes to our PCR. So the first thing I want you guys to look at is this. The PCR is basically some big poly something word chain reaction percentage positivity rate. So basically what it is the main test that they use, the ODP uses to go ahead and determine whether or not your community is basically there's a chance that the spread of the virus is very, very high in your particular community. So basically what it does is the PCR positivity rate is determined by the number of positive PCR testing divided by the number of negative cases. So essentially what it's stating is, for an example, if 100 people are tested and that 3 of them are positive for COVID, that means it's 3%. So currently, whenever I'm making this training here on December 1st, our current PCR is 17.3. So basically, it's stating that 17 out of every 100 cases that are being tested for COVID are positive. We'll talk a little bit more about these red, yellow, and green options here in a minute. But one thing I did want to show you is it's very, very simple to be able to look for these PCRs and find out where we particularly are in Cambria County. The easiest way to do it is just do a quick Google search. And then what you're going to do is type in Pennsylvania Department of Health COVID. So that's PA space DOH space COVID. If you click on that and hit enter, it's going to give you a couple different options here. And if you see where it says COVID-19 early warning, if you click on that, basically this is where you're going to find your PCRs. So this is the Department of Pennsylvania, the Pennsylvania Department of Health's website concerning tracking of COVID and COVID numbers. It gives you up-to-date information on everything, what the state is running, but then it also gives you the abilities that you can actually click on Cambria County. So if you click on Cambria County, it is actually giving you all this information, and our PCR is 17.4. So I was wrong, 17.3. It's actually 17.4. It basically gives you more information about that PCR and kind of where we're going, concerning that. But right now we are at 17.4. If you look at other counties like Bedford, they're at 2.3. If you look at Somerset, they're at 22.3. If you look at Indiana, Indiana is currently at 16.8. We look at Blair County, they're currently at 14.2, which they actually went down 1.1%. If you look at Huntington actually, its numbers were really, really bad. They were in the 20s. They're getting down to 16%. If you look at Clearfield, their numbers are not nearly as bad as Blair's, but they're pretty high. And then Center County is actually 5.8. So if you look at some of the closer states or closer counties towards the big cities, you can actually see that um, some of their PCRs are actually pretty decent. So right now, it's really, really affecting a lot of the rural areas like ours, but it looks like it's affecting a lot of the state. So knowing that our PCR is currently 17.4, ODP is making recommendations of visitors in the homes and visitations basically based upon your PCR. So basically what they're saying is that if you are less than 5%, that there are no restrictions on having visitors in your home or you being able to visit other people. A moderate level basically states that their recommendations, first off, is 5 to 10%. Basically, what they're stating is that you cannot have any indoor home visits that might increase the exposure to COVID-19. Sometimes there's exceptions to that, so just contact your medical department whenever we're there. But anytime that we are above 10% interaction through means other than in-person contact, unless permission is given by the medical coordinator. But it gives detailed instructions on exactly what we should be following. But it's basically essentially stating that anytime that we're in the substantial section, that our county is insubstantial, that means that all interactions between each other, all interactions should be limited as much as possible. Like I said, all detailed information can be found here under Therap, under the policies and procedures for COVID. It gives you definitely good information, all the policies that we as an office are following. So if you do become sick, these are the things that we are going to do and that we follow to go ahead and ensure that everybody's safe. How to report it to the county and how to report it to the state. Talks a little bit more about our backup plans and everything like that. But like I said, how you actually find the PCR is just by doing a quick Google search and typing in PA DOH-COVID. And basically click on the COVID-19 early warning link. Click on that. It'll pull up a map of Pennsylvania. You click on Cambria. And that is pretty much where we're doing. So another thing is I want to talk a little bit more about contact tracing. So let's go ahead and discuss that here in a minute. All right, so contact tracing is basically a system that we use to go ahead and look at COVID-related incidents and determine how we can stop the spread of COVID. So I'm going to go ahead and just do a couple notes here. So I'm going to pretend that we have Franklin 2, and we have Foster, and we have Corey, and we have Main Street. So we have those particular homes. Kind of hard to do that because my camera is doing it backwards. So we have Franklin 2, we have Foster. We have Corey. have Jim that works at Foster and Steve that work at Foster. And John and Mary, Jen, and Tim. And then we have Albert and Robert that work at these houses. So Steve has an issue because he needs to take off because he's not feeling well. And basically Jim says, "Hey Jen, can you come over to Foster and pick up a shift for me?" Now what happens is we find out that Tim has COVID. Jen and Tim work together at Corey, and Jen had direct exposure to Tim, meaning that she came within 6 foot of Tim for more than 15 minutes throughout the entire day. Jen eventually gets COVID. And now she is in the same house with Foster, with Steve and Jim. And then essentially what happens is so Steve was sick, Jim was working, but then Robert asked Jim, or Jim asked Robert, or however, which then means that now, instead of just having one house with COVID, now we have 3 houses that have COVID. So it is very, 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 very important that we try our hardest to not try to pick up shifts in other homes. I understand that sometimes it's inevitable and we have to do it because there's no one to pick it up. And then that means that that person is stuck on shifts for long periods of time. But that's where we have to utilize our COVID backup plans. So things like, let's say, for instance, you're stuck on a 24-hour straight shift. So instead of having someone pick up the 12 to 8 shift, you as the staff member can go ahead and stay for the whole entire 24 hours, yet sleep whenever the individual is sleeping. Within the ISP gives us that ability so that we can do that. Like I said, all of that information can be found under the Sunset COVID policies and procedures listed in Therap. Or also listed in the ISP under COVID backup plan under the staffing section. So the staff. So basically, it gives the abilities for some houses like Franklin 2 to go from 2-to-1 staffing to 1-to-1 staffing. It also gives the houses like Franklin 1 the abilities to allow, instead of having 2 staff there, they can have 1 staff that takes care of both individuals. We can also go ahead and combine individuals in other homes. So Travis can be moved over to G's house. And then it also gives you the abilities that you can go ahead and sleep during during shifts. All this information is here, but I would definitely highly recommend that you go into the person's ISP. And the easiest way to do that, just in case you don't have an ISP at the house, very, very simple. So go back into Therap, click on individual homepage, click on your individual. Under here, it gives you the option to go to document storage. You can go ahead and hit list. Here's the current ISP, the current BSP. Click on ISP. You click on the PDF. Open up the PDF. And very, very simple. All you have to do is hit the Control and F button. Control and F. And basically what that does is it gives you a search down menu. So once again, you hit on your keyboard, hit the Control and F button. And then all you have to do is type in COVID. And right here it states to maintain adequate staffing to protect the individual's safety and well-being of the individuals, staff, community members, blah, 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 blah. Basically gives you the abilities that you can work for more than 16 hours, that staff members can sleep. She gives you the abilities that levels of supervision may be changed. Please ensure that someone from the office, myself, Mindy, Brandon, anytime that you do use a COVID backup plan, make sure that you let us know. That way we can let the supports coordinators know that we're implementing the backup plan. So that way, whenever they're calling in and checking on their individuals and finding out that staff are sleeping whenever they're not supposed to be, or the staffing ratios, instead of being 2 staff there, it's only 1. Just make sure you're letting us know. That way we can implement that a little bit more. So that's pretty much COVID. So as far as COVID goes, right now we did have it a shelter-in-place recommendation to all individuals and all staff members not to pick up any other extra shifts in other homes, that they should be staying in place and they can't be going out into the community. Now that shelter-in-place order is removed, individuals can go back out into the community, but we must ensure that we're properly social distancing, that we're wearing our masks, including the individuals. They need to be wearing their masks, making sure that whenever they are going into any community setting or any setting, that they're not touching surfaces, that they're not putting their fingers in their mouths, they're not picking their noses, they're not, wiping their noses with their sleeve. Whenever they're opening doors, use your jacket sleeve to open up the doors, or have gloves. You can always take, latex gloves with you and have them in your pocket and open up the doors that way. Making sure that if anyone is in your personal space within 6 feet of you, to move into an area that you have that 6-foot distance. I understand sometimes you go in sheets and it's very, very hard whenever people are coming up right up against you. Just go ahead and shift over and move over to an area that you can maintain your 6-foot distance and ensure that your individuals are educated on that. That's what we need to do. But you guys as team leaders, not only are you training your staff or training your individuals on this, train your staff to go ahead and do the same thing, because I know that even though you guys are working a lot of hours, your staff are there as well, when we need to make sure that we're preaching this information also to the staff as well. So that's pretty much the COVID spiel. I can give you any more additional information. Feel free to give me a call. The last thing I wanted to discuss with you guys is Therap. So we're going to start entering into phase 2. We're going to start implementing a lot more things. There are still a lot of staff members that are not using Therap to go ahead and document. So one thing I want to show you is, first off, later on in the week, I'm going to go ahead. I had a request to go ahead and do a YouTube video just like this of the training that we had here at the office in the training office. So I'm going to go ahead and I'm going to post a video like that on the YouTube channel as well, so you can ensure that if your staff have additional questions, that they can refer to that video. But you guys as team leaders, for the most part, have a good understanding on what I'm looking for and what the team is looking for concerning Therap. But I just wanted to show you guys this a little bit more. The biggest things right now in Therap that you guys are doing, one of those is located under the agency tab. If you scroll to the very, very bottom, there is a staff's visitors log under questionnaire forms. And this is where you guys are doing your staff visitors log. Like I said, there's more detailed information whenever I do the YouTube video of how to do this, but everyone should have a good understanding of this. I'm going to do one thing real quick. I just went into a fictitious account just to kind of give you some training. That way we can actually enter this. We're going to go ahead and pretend to do a new staff visitors log. And how you're going to do that is list the location that you're working. So I'm going to pretend that I'm working at St. Thomas with Dave. You're going to enter the date. And the time that you're reporting to work. So if I'm coming in at 4 o'clock, then I would type in 4 p.m. And then I would open up the staff visitors log and I would go ahead and fill out the information. Remember, always hit save and next. It's going really slow, so go ahead and answer all the different questions that are there, and then of course hit the save button. In this beta site, it's an old site, so in live therapy should be a lot better. If there is issues about that, please let me know. If you guys are having some lagging issues like this, every single time that I've used Therap, there doesn't seem to be nearly as much lagging issues. So I'm thinking it's just this beta site. And what time you're supposed to be done with the shift. And that was 97.1 this morning. I'm not sick. Any additional information? Please pop up. Submit it. And that is how you do a staff visitors log. That's one thing. Next, we're going to go ahead and look at the other ones. So right now we're working on TIF, on how to do a GER. So anytime that there's a reportable incident and it needs to be reported, Not only does it need to be entered, or not only does a phone call need to be made to Mindy or to the medical coordinator, but there also should be a Therap entry entered in the Therap under the GER. That way we have information concerning it. Actually, let me go back. I'm trying to keep to keeping this as HIPAA compliant as I can. I'm not providing actual real data. So today we're going to pretend that we're doing this. So remember, it's either injury, medication error, or other. Most of everything else is other. I meant everything is either med error, restraint related to a behavior, or other. So in this case here, we are going to the doctor, or not to the doctor, but going to the hospital because of she cut her leg. We're going to go ahead and do it under other. Every notification level is high. That information should automatically populate. What happened before the incident? She was playing in the living room and cut her foot. There was no abuse, no neglect, no exploitation. We're going to go ahead and hit next. When it happened, so first off, what it was, what there was an accident. What you're going to do here is just use the best option that's possibly there. So fall without injury. We're going to go hospital. We're going to take her to the hospital. Actually, we're going to go ER, actually. Not hospital, yeah. Here, she went to the ER and didn't get admitted, but she was just in the ER. She went there for medical. And what time? So we're going to go, she's going to go at 12 o'clock. We actually saw it happened. It happened in the living room, I said. And then this is the meat and potatoes, so this is where you're going to go ahead and type in as much detailed information as possible. We're going to go ahead and hit the next button. Guess it can't happen there, so we're going to do it at 12:15 because the reason why we're getting that error message is because it is not 5 o'clock yet. It is only 12. I mean, it is only 4 o'clock right now, so. Remember, like I said, corrective action, future corrective actions. You as team leaders could go ahead and put a corrective action. Maybe we found out that she cut her leg on a sharp piece of metal. So you can do a corrective action of, please contact somebody to go ahead and remove the metal, maintenance department. This is where you're going to go ahead and you're going to say that you notified your residential manager, which would be Mindy, or the medical coordinator if you contacted Janet. So whoever that would be, let's go ahead and pretend we're going to contact Janet. And we contacted her at 4:30. I haven't figured out an easier way to do this. So that is how we're doing it right now. And we're letting her know by phone. We're going to preview it. You have any pictures? That might be a good place to put a picture. Scroll down, review all of it. Scroll down to the very, very bottom and hit submit. And that is how you do it. We'll come back in as office personnel and review it and see if there's anything that needs to be added, but that is how you do a GER. The other things that you're going to be doing now, that your staff should be doing as well, is T-logs. It's very, very simple. You're just going to go ahead and do general. and all regular T-logs are listed under low. You're going to go ahead and provide the house in which you're doing this at. So in this case here, it's Clark, and then the date, and then the shift that you are working. So you're working before midnight. I always put in 11:4:59 p.m. And then what I do here is I do 4 p.m. and then I put Travis was watching TV and speaking with staff. As much information in here as possible. I mean, this is basically stating that we're providing services and we're receiving money to provide these services. What is he doing? If you type in there, he's watching TV from 4 o'clock all the way until midnight. ODP is probably going to state, why are we paying you for him to sit and watch TV? So basically any detailed information, Travis was watching TV, staff were able to get him up and he cleaned the living room, and then he used the bathroom, any detailed information that you can. Under reporter, you don't need anything. You just go ahead and hit the submit button. Go back to forms. Now you can actually go ahead and update it. And you can actually go here, go 5 here. And update it. Most of you probably do it a different way. Most of you probably go into jump back there. Like I said, the main website is a lot easier to use. And most of you probably do a search and just do a search for today. Everybody remember that this little plus button right here literally goes to today. This is going to look at all the entries for today. All right, so it looks like Cheyenne did her log from 8 to 4. Not seeing a 12 to 8 entry, so Courtney, make sure you get on that. So if you wanted to go ahead and update that particular one, all you have to do is scroll to the bottom, click on update, and then basically add additional information right here. I'm not going to save this because this is actually live data, so I'm not going to actually do that. But all right, so pretty much we did everything. The only thing that's left is doing the sleep charts. And that's very simple. So we can look at yesterday's daily log and see how Dave did. Okay. An hour nap between 4 and 5. All right, so I am expecting that by the 1st of January that all entries into Therap should be done using the computer. So those team leaders that are very, very comfortable with this, this is pretty much the way that we would like to have it done. And I'm pretty comfortable with mostly all the team leaders that are here. We need to ensure that your staff by January 1st, if not sooner, are documenting everything in Therap. And then we're going to start implementing new things like under the health tabs. We're going to go ahead and start utilizing weights and I don't know if we're going to be doing doctor's appointments, but blood sugar readings, whether or not the females are on their period or not, vital signs, a lot of these different things can be tracked here in Therap as well. But I wanted to make sure that that all staff members are using Therap to have their entries and put it into the system. We are no longer going to be receiving and accepting paper copies of documentation. Everything needs to be done in Therap. Like I said, January 1st is the date that we're going to go ahead and implement this. It is your responsibility as team leaders to ensure that they're doing it. If they are not doing it, they are written up. And basically, I'll give you guys, just let me or Brandon know that you're having issues with particular staff member not being able to go ahead and do Therap entries. And that will ensure that you have the abilities to sit down with them and get the training that they need to go ahead and do the entries into Therap. So that is pretty much everything. If you guys have any questions, I'm available pretty much the rest of the week. I'd say go ahead and get a hold of me in the afternoon on Thursday or Friday. If you have any further questions about anything that we discussed today. Thank you so much, everybody, and have yourself a great weekend.